Hey everyone, Dr. Saccone here with MedCore Asthma and Pulmonary. First off, thank you so much for the overwhelming response to my first video on the coronavirus. Because of all the interest, I've decided to continue this and delve deeper and continue to keep you informed and up to date on the latest information. Additionally, I have received some questions through Facebook and I will incorporate these into the talk today. First off, everyone remain calm. We're going to get through this. What we're seeing is expected, and it's not looking like we're heading into a zombie apocalypse anytime soon. So, in the video today, I'll give you a general update on the outbreaks, the cases, and what we're seeing in the medical field. We'll talk about what happened in Italy, what flattening the curve means, and social distancing measures that we're seeing. Also, we can talk about different scenarios on how this virus is going to play out, worst case, best case, and what I think is a realistic trajectory of this pandemic. Also, we'll discuss when to go to the doctor, ER versus just riding it out at home. So, as of today, March 19th in the United States, there are about 9,500 cases with 150 total deaths. This conveys about a 1.5% fatality rate. And in New Jersey, there are 457 cases and only 5 deaths, conveying about a 0.07 fatality rate. These numbers are similar to what we're seeing around the world in many countries. China, Iran, and Italy are exceptions. Now, I'm sure you've been hearing the daily number of cases, and I've heard the huge spike in cases over the past few days. Now stay calm and rest assured, this is okay. This is what we expected, and it's merely a reflection of the fact that we are testing more, thus identifying more cases. Before, we were only testing the sickest. Now, we're testing anyone with a fever and a cough, so we're finding more. This doesn't necessarily mean the virus is suddenly spreading more rampantly, we are just identifying it more. Now, the virus is spreading, but identifying those affected is key to slowing the spread. If we continue to see this heightened increase in spread, that's time to panic, but this should level off as we continue with the aggressive testing. Now, the question of Italy. What happened and why? And are we next? Italy had a tremendous spike in the number of cases in a very short period of time. Not only were the cases high, but the people were sicker. And there's been an overwhelming toll on the medical system, resulting in not enough ICU beds and life support systems, but not enough doctors and nurses to save all the very ill people. And this has led to extremely high death toll and fatality rate, which is higher than most countries, nearly about 8%. Now, a lot of this has to do with the fact that Italy has a dense population, so it spread quicker. Italy also has an older average population compared to other areas, so when those got sick, they got sicker and they needed more aggressive medical services, and this overtaxed the system. Also, Italians have a lot of what's called cross-generational pollination, meaning the younger crowd associates with their grandparents and older relatives much more frequently than other nations, which increases the rate of transmission to those more vulnerable people. We also know that Italians are a lot more accustomed to hugging, kissing, and doing many of these things that we're stressing increase the spread. We've been seeing the Facebook graphic showing that we're about 1 to 2 weeks away from being Italy. Could this happen in the US? Yes, of course it can. But I don't think it's going to happen in the same fashion or as dramatic. For starters, comparing the US to Italy is not comparing apples to apples. The US is over 30 times the land area that Italy is, but only 5 to 6 times the population, meaning Italy is much more densely populated. Likewise, seeing a similar infection rate trajectory in other countries doesn't mean much because, again, the density and the size of the countries is not equivocal. Plus, we have a more diverse and accessible healthcare system, and being blunt, the best doctors, nurses, pharmacists, and healthcare in the world. Additionally, we've taken immense measures to slow the influx of patients, and so far it seems that this tactic is helping, but it is too soon to tell. This leads to the phrase that many of us are sick of hearing, flatten the curve. We realize the majority of the patients that are dying are older. They have multiple medical conditions or compromised immune systems. The fatality rate in the US is about 1%, meaning 99% are surviving this. So why is there so much concern? The concern isn't necessarily the survival rate, it's the overburdening the healthcare system, and that the people who should survive this can't because they can't get the life-saving care that they need. When we speak of flattening the curve, we are assuming that containment is no longer an option, but we are trying to slow the spread. If you look at the typical graphic going around, both of these curves have a similar area under the curve, or patients that are infected. The solid line is the healthcare capacity. The first curve is what happened in Italy, a quick, rapid upstroke which superseded the healthcare capability. The goal of the protective measures, social distancing, etc., is to slow the spread. In other words, spread these cases out over a longer time, so there's time to have turnover in the facilities and we do not overwhelm them. So, by the government causing us all to be shut-ins, the goal is to limit us from spreading it, thus slowing the spread, and thus flattening this proverbial curve. Will we see scenarios like what are being seen in Italy? It's tough to tell. I don't believe so. We might see it in larger cities where it would be harder to contain, but I do believe we have the capability to move patients to other hospitals, fashion temporary hospitals, and we're even bringing in the Navy ships Comfort and Mercy to help allay this issue. But exact utilization of those hospital ships and when they'd be ready is still something that's being discussed. So let's talk some scenarios, worst case, best case, and talk through them as what some of the leading epidemiologists are expecting, and I'll interject my humble opinion as well. Okay, so the worst case, the doomsday scenario. Now I'd like to say that even in the worst scenario, I don't think it's as bad as some people have envisioned it's going to be. Most experts say that at the worst case, 40 to 70% of the population are going to become infected with the virus. For the sake of math, assume that 50% of the country becomes infected in my doomsday scenario. That would mean 150 million people would become afflicted with this. At the expected fatality rate of 1%, that would result in 1.5 million American deaths. Now this would be very, very bad. 10 deaths is bad. This would be terrible. However, by comparison, the Spanish flu had a death toll in the United States of about 500,000 Americans. But you need to consider that was roughly a third of the population at that time. 1.5 million deaths now would be less than 1% of the population. Not good, but by comparison, this doomsday scenario is favorable to other pandemics in the past. Best case scenario. Let's be honest. This virus is not going to disappear after closing the gyms and schools and restaurants for 2 weeks. However, the best case scenario that we can assume is that we break this cycle. We limit the host for the virus to attach to, and we see it dissipate into the environment with some occasional spikes. But it gets kept generally in check by the rest of the U.S. population's immunity. Best case scenario is we see 10 to 20,000 cases with roughly 200 deaths. I think that that's a little too optimistic, but it does show kind of both sides of the spectrum here. So what is my take on all of this? I've read some of the most recent literature and epidemiologic studies. And I feel that what we're going to see is a diminishing return. The social distancing will cause a decrease in the transmission. This will cause a leveling off of the cases, but we can't expect it to be rapid. The 2-week shutdown is not going to be long enough, but we're going to need to balance the virus effects with also the effects of irreversibly damaging our country and small businesses. And these details are going to become clearer in the next days to week. I expect that we'll see about 50,000 cases in the United States. And with that fatality rate of about 1% or less, we're going to have about 500 to 1,000 or so deaths. Now there is a healthy bit of optimism here, but I am going off of current numbers and projections. It's not great, but it's also not terrible, all things considered. And I think we can see possibly getting back to a normal way of life in May. So, when should you seek medical help? Now, if you think you have corona or came in contact with someone with coronavirus and have severe symptoms, a fever over 104, shortness of breath, lowering oxygen levels, go to the nearest ER. But call first and notify them that you're coming in, and that way they can make the necessary preparations and isolation precautions so you don't infect other people. If you think you have corona or came in contact with someone with coronavirus and your symptoms are mild, stay home, self-quarantine yourself. Showing up at your PCP's office, urgent care, emergency room, or pulmonologist only potentially exposes others to the virus. Right now, the treatment for mild to moderate symptoms is supportive care. You can also check in on your local hospital websites and news websites and see if your symptoms match that of COVID, and you can be directed to some of these drive-through testing sites. Now, more tests is going to equal more cases, but this will help us better characterize this virus and let people be quarantined who really need to be quarantined. Now, if you do go to your doctor's office, don't bring your family unless it's absolutely needed. Come as prepared as possible to minimize time in the waiting room, and inform the staff prior to arrival if you have any fever or any of the other COVID symptoms. We can come out and triage you in your car rather than coming in and infecting everybody in the waiting room. So, Few people have asked me if I feel the current measures in New Jersey, Pennsylvania, New York, etc. are overkill. My answer is I think so. But moreover, I hope so. The goal of these measures is to look back and say, hey, we did too much versus we did too little. Should we go into a complete lockdown and quarantine ourselves in our houses? Well, this ends up causing panic. And we already have a fair amount of panic going on. And when you create panic, as we're seeing now, you also create an equal and opposite degree of apathy and denial. So what we have in the United States right now is we have two large groups of people. We have the people with this apocalyptic view, which ends up spreading fear, panic, and buying all the toilet paper. And then the opposite end, it's not that bad. I don't care if I get it. I don't have old friends. And the truth is always somewhere in the middle. Yes, you may be young, and COVID may just be a bad cold for you. But you could pass it on to a group of people that will die from it. For that reason, we need to be socially responsible, suck it up, and do our part. But creating panic also has its own set of issues, causing worsening aspects of other health, and having people inundate the healthcare system with just the sniffles. As I said, the truth is somewhere in the middle. I think we're going to see this kind of get clarified about what the right level of response will be, but for right now, as I said before, exercising caution, not panic, is the best way to go. I've been following this very close from the beginning, and our government, both local and national, has done a very good job in its response. It hasn't been perfect, and it never will be, but I feel the right measures have been taken. Finally, to reiterate, wash your hands. Don't touch your face. Stay home as much as possible. Avoid large gatherings. Use telemedicine appointments if you're sick, if that's offered by your physician. It is offered by us. And utilize the viral testing if it's applicable. Please continue to abide by the laws and suggestions of the government and your healthcare workers. We're going to get through this. I hope you enjoyed this more in-depth take on this topic. Take care, stay healthy, God bless. If you have any specific questions, feel free to have it in the comments section. And if you enjoyed this video, please like us on Facebook. The link is at the top of the post. Have a great day.